everyone, my name is Katie Sheridan, family nurse practitioner student at Auburn University, recording a head-to-toe assessment video on patient Katie. We will remain clothed for this entire exam, but in a normal setting, patient will be in a gown. Also, that's to preserve modesty. Also, we will only do our exams on one side of the body instead of bilaterally because to preserve time. So, with that being said, patient's vitals are normal. My hands have been washed. We'll go ahead and get started. Patient is well groomed, looks appropriate for her age, has good posture and good hygiene. We'll go ahead and start by just inspecting the skin, looking at her nail beds. All of that looks good. Hair looks good, has a normal distribution, normal texture. It's not dry and brittle. We'll go ahead and palpate the head. I don't see any lesions, any lumps, and no infestations are present. Now I'll move down and I will palpate your temporomandibular joints. I want you to open and close your jaw for me. All right, she does that easily. There's no popping, no crepitus, and you didn't have any pain with that, did you? Mm-hmm. Okay, now I'm gonna palpate the frontal and the maxillary sinuses. No tenderness. Now we'll go ahead and move on and do the look at the nose. I'm gonna have you breathe in. Both nares are patent. The nose appears to be midline. We'll look at the mucosa and the turbinates. Okay, they are both pink and moist. The septum is midline. There is no perforation, no deviation. There is no excessive exudate or bleeding in the nasal cavity either. Now we'll move on to the mouth. The lips look good. They are pink and moist, no dryness, no cracking. Have you open up? Okay. Looking at the buccal mucosa, the floor of the mouth, the roof of the mouth. Have you stick your tongue out? Say ah. The uvula is midline. The mucosa is pink, moist, no ulcers, no white patches. The gums look good. There's no bleeding. I'm just gonna look at your teeth. All right, say ah a little bit. All right, teeth look good. There's a history of cavities, but no present abnormalities. So now we will move on and look at that patient's eyes. Eyes are round and symmetrical. Pupils are about 3 millimeters. They react to light. Eyelashes and eyebrows have a normal hair distribution. Eyelids are equal. The conjunctiva is pink and moist. The lacrimal duct is patent. The sclera is white bilaterally. The cornea and the lens are normal with no opacities noted, and the iris is the same bilateral. So now we will go ahead and do the ophthalmoscope exam. We'll be looking at the fundus, the optic disc, the macula, checking for a red light reflex, and looking at the vessels of the eye. Go ahead and do that. Okay. I'll have you look straight ahead, okay? All right, so the red reflex is present. The fundus, the macula, and the disc were visible, and the vessels look normal with no narrowing and no hemorrhaging. Now we will move on and look at the ears. I'm just going to palpate the auricle, make sure there's no tenderness, there's no redness, and there's no swelling. Now I'm going to look at the ear canal. All right, the canal is patent. There is no redness, no discharge, no wax buildup, no foreign bodies. The tympanic membrane is a pearly gray. There is a cone of light visible on the eardrum, and the malleus bone is visible. Now we'll move on and do the Weber test. This test for lateralization. I just want you to tell me if you hear this the same in both ears once I stick it on top of your head, okay?
Yes.
Okay. So now we will move on and do the Rene test. This is to test air to bone conduction. I will hit it, put it behind your ear, and then move it to the front, and you just tell me when you stop hearing the vibration.
Okay. Okay.
Okay, and that is a normal finding because the air conduction was longer than the bone conduction. So now we'll move on and do the cranial nerves all at once. So I'm gonna start by having you close your eyes. And I just want you to tell me what you smell.
Alcohol.
Okay, so cranial nerve 1 is intact. Now we will do 2 and 3. We're just gonna check for pupil reaction to light and accommodation. Get you to follow this to your nose. Alrighty. And we will test visual acuity with our Snellen chart. So I'm just gonna have you read line 8.
Okay.
You cover body, there you go.
D-E-F-P-O-T-E-C.
Okay, you can do it with just both eyes open.
D-E-F-P-O-T-E-C.
Okay, so the patient has 20/20 vision in the right eye, the left eye, and bilaterally. Okay, now we will do cranial nerves 3, 4, and 6. I just want you to follow my finger. This is going to touch your 6 fields of vision. So just. All right, and to go along with cranial nerve 2, we're also going to do the finger wiggle test. So I just want you to cover up this eye, your left eye. And I just want you to tell me when you see my fingers, okay?
Okay. I see them. I see them. I see them. I see them.
Okay, and so now we're going to move on and do cranial nerve 5. So I am going to palpate your jaw. All right, that feels good. Clench it up for me. All right, that feels good. Now I'm going to have you close your eyes. I just want you to tell me if you feel sharp or dull, okay?
Dull. 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 Sharp. Sharp. Sharp.
Okay, and now I am going to touch your face. I'm going to close your eyes. I just want you to tell me where you feel me touching your face, okay?
Nose. Forehead. Cheek. Chin.
Okay. Now we will do that was cranial nerve 5, it is intact. Now we'll do cranial nerve 7. I just want you to clench your eyes shut, raise your eyebrows up. You can smile, frown, puff out your cheeks. Okay, so cranial nerve 7 is intact. Now I'll do cranial nerve 8. I'm just going to whisper something behind your head and you just tell me what words you heard.
Okay. 4, 5.
Okay, cranial nerve 8 is intact. Now we'll do 9 and 10. I'm just going to have you open your mouth. Okay, stick your tongue out. Say ah, ah. Okay, now we're going to test your gag reflex. Okay, so it is present. The uvula moves, is midline, and moves when she says ah. So 9 and 10 are intact. I'm going to have you stick your tongue out, move it side to side and up and down. So cranial nerve 12 is intact. Now I'll do 11. I just want you to stroke against my shoulders. Okay, move your head side to side and front and back. Okay, so all of her cranial nerves were intact. Now we'll move on and examine your neck. I'm just gonna look around, inspect. I don't see any lumps, visible lumps, any scarring, anything like that. So I'm going to go ahead and just palpate for any tenderness, palpate the carotid arteries. Okay, listen for bruise. Okay, Waltzes are +2 bilateral with no bruise and a regular rate and rhythm. Now I'm going to palpate your lymph nodes. Your preauricular, postauricular, occipital, tonsillar, tonsillar, submandibular, submental, anterior cervical chain, posterior cervical chain, and supraclavicular. And I don't feel any lymph nodes. That's a normal finding. I'm gonna palpate your trachea. It's midline. I'm just gonna step behind you a little bit. All right, I'm gonna have you swallow. Okay, palpate the thyroid gland, which feels good. There's no extra lobes present. Now I am gonna have you lean back on the bed and assess your jugular vein. I'm just gonna have you look away from me while we do this. As the patient leans back and is looking away from me, her internal and external jugular vein will start to bulge, and that is a normal assessment. We'll sit you back up. Okay, and now I'm going to test the range of motion of your neck. I just want you to look all the way forward, neck to your chin, and lean your head all the way back, and then do your head side to side and all around. All right, she has full range of motion in her neck. Now we will move and do your posterior thorax exam. Which have you turn your face that way. We'll start by just inspecting the skin. There's no cyanosis, no pallor, no audible sounds of breathing, no use of accessory muscles. Respirations appear to be even and unlabored. I'm just going to start palpating for any tenderness that you may feel. Okay, no tenderness. I'm going to put my thumbs at the 10th rib and have you breathe in. That's a test for respiratory expansion tenderness, and you didn't have any. Now I'm going to check for CVA tenderness. Just tell me if you hurt down here when I do this. No pain? Okay. Now we're going to do tactile firmness. When I put my hands on your back, every time I move them, I want you to say 99, okay?
Okay. 99, 99, 99, 99, 99.
Okay. That sounds good. Now we will percuss the lungs from the apices to the base, okay?
Okay.
Okay, that sounds good. The lungs were resonant throughout. Now I'm going to palpate for diaphragmatic excursion. So I want you to breathe in and hold it for me. Okay. Now I want you to exhale as much as you can and hold that for me. Okay. Now I'm going to measure this, and the distance between the two is about 4 centimeters. So that is a normal finding for the diaphragmatic excursion. Now we will move along, and I will listen to her lung sounds. Okay, breathe in for me. Breathe in. Breathe in. Breathe in. Breathe in. Breathe in. All right, all sounds good. Her lung sounds are clear. There are no adventitious lung sounds. Okay, I'm just now going to go ahead and get you to lay back again on the bed. We're going to do your anterior thorax and chest. We'll just inspect the skin. All of that looks good. At this time is when we would perform a breast exam, which will be deferred for this. We would just palpate all lobes of the breast into the tail of Spence and encourage the patient to maintain her home breast exams at least once a month. So for now, we'll just move on. And I will inspect the skin. All looks good. We will palpate for any tenderness on the chest. We're going to palpate at the cardiac points, aortic, pulmonic, Erb's point, tricuspid, and mitral. And at this time is the time that we would try to feel the apical pulse, and I don't feel hers, which is a normal finding. And I don't feel any thrills or pulsations at any of her cardiac points. So now I'm going to percuss her lungs from the front on the interior. All right, and all that sounds good. It was resonant throughout. I'm going to do my hands again. I want you to just say 99 again.
99, 99, 99, 99.
Okay, so tactile firmness on the front is Good as well. Now I'm going to auscultate her lung sounds on the front. Breathe in. Okay. Okay. And now we will also take the heart sounds at all 5 cardiac points of the diaphragm and the belt of the stethoscope in the sitting and lying position. And just hang out.
Sure.
Alrighty. I'm gonna lay you back. We're gonna listen some more. I'm letting you up, not letting you back this thing. All right, you can stay laying back. S1 and S2 are present. There are no additional heart sounds, no murmurs, or no thrills, no rubs heard throughout the heart sounds. And now I'm gonna just check your pulses. We'll do radial, brachial. We already did carotid, and we would do femoral, but we're gonna defer that for now. All the pulses are +2 bilateral with a regular rate and rhythm. Now we're gonna do the abdominal assessment. Go ahead and only. Okay, now, let me think. We will go ahead and auscultate. Well, we'll inspect the abdomen first for contour. It has a good shape. There is no visible peristalsis or pulsations. We will auscultate the all 4 abdominal quadrants and listen for bruits at the aorta, the iliac, and the renal arteries, and we would also do it at the femoral artery. All right. All right, vowel sounds are active and present times 4. Now I will auscultate for any bruits. All right, and I do not hear any bruits. Now we will percuss all 4 quadrants. All right, that sounds good. Now we will percuss the liver. Get my tape. And my measurer. Come over here. We'll percuss for the liver size at the mid-clavicular line. Should me. Alright, and this space is about 7.3 centimeters, which is a normal finding, which is 7 to 8 centimeters. Right, that's good. Now we will just lightly palpate the abdomen. Tenderness. Alright, and then we would deeply palpate the abdomen. Try to get Feel the liver and her kidney, which you cannot feel, which is a normal finding. And now we're going to do just your abdominal reflex real quick. Just grab this. All right. That is good. I'm going to sit you up and we're going to move on to your arms. All right. I am going to just assess her, just look at her skin. It looks good, normal muscle mass, normal hair distribution. I'm gonna do her capillary refill. It's less than 2 seconds. Let you grip my hands. They are equal bilateral. Hold your arms like this. Okay, pull against me. Okay, I'll push against me. Okay, muscle strength is a 5 out of 5. Now I'm just going to palpate the shoulder, which feels good. No tenderness. Okay, I'm just gonna let you do what I do. Just lift your arm up, swing it back, go out, over your chest, behind your back, behind your head. All right, and she has full range of motion in that joint with no popping or crepitus when I move it. Do her elbow. Feels good. She should bend it up, straighten it out, and twist it over. All right, that is good. And now we will do your wrist and your hand. Just look at your fingers, look at your joints, palpate, inspect. All right, I'm gonna have you do your wrist forward, up, side to side, and all around. All right, and have you open your fingers and do them like this. Open them back up. We're going to test your finger strength. Try to push against me. Look with your fingers. You're going to open your hand. All right. And then now I'm going to have you open them. I'm going to try to push them closed and you just push against me again. All right. And that is good. And we're going to assess her epitrochlear nodes. Try to palpate those. And I don't feel any, so that's normal. I'm just going to have you also hold out your hand and close your eyes and tell me what this object is.
A paper clip.
Yep. Okay, good job. And now I'm going to have you hold out your hand. That was stereognosis. Now we're going to do graphesthesia. So I'm going to get you to close your hand and tell me what I write in it.
A.
Yes, so the sensation in her hands is good. Now I will lean you back one more last time and do your hips. First, palpate those joints. All right, you just tell me, does that feel okay?
Yes.
Everything feels okay? Okay, so now I'm just gonna get you to put your legs straight out. Straight out to the side. Good job. Okay, put it back together. Lift it straight up and cross your leg over your other leg like this. All right, so she has full range of motion in her hip. Move down and do the knee. Feels good, no swelling or anything. Okay, so then I'll get you to just pull your knee up to your chest like that. Okay, that is good. And I'm gonna squat down now and just do your ankle and your foot. Alrighty. No tenderness, unless you just point your foot towards the ground, lift it all the way up towards the sky. Do your foot in towards your other foot, out towards my way, and roll it around in a circle. So she has full range of motion there. Now I'm going to test your sensation. So I just want you to tell me like where on your foot I'm touching.
Okay. The inner part of the foot.
Okay.
Toe. Top of the foot.
Okay, so the sensation is good. Capillary refill is good. Less than 2 seconds. I'm gonna have you pull against me with your leg or push against my hand with your leg. This way? Yeah. Okay, and then now push against me. Okay, so her muscle strength in her lower leg is a 5 out of 5. Now I'm gonna assess her pulses while I'm down here. Dorsalis pedis, posterior tibialis, and popliteal. They are all +2 and regular. Now I'm gonna sit you up and we're gonna do all of your reflexes at one time. Just all your reflexes. Okay, I'll let you rest your arm in your lap, okay? So we will start with radial. Just relax your arm, okay? Okay, now we will do brachial. Okay, have you hold your arm up right now like this and just relax it. This is your tricep, just relax your arm in my hand, be limp, okay? Okay. Now we'll do patellar. Okay, and Achilles. Okay, and Babenski, which you won't have any response to because that is a normal finding. Now I'm gonna have you, you're gonna just stand up, put your arms up by your side, and close your eyes. Okay, this is a Romberg test, and it is normal because she has no swaying. I'm gonna have you just assess your gait. I just want you to walk to that wall. Okay, that is normal. Now walk on your tiptoes for a few steps back to me. Okay, and then walk heel to toe like this. There you go. All right, now you can turn around and come back.
Same.
It doesn't matter.
Okay.
All righty. So that will conclude our head to toe assessment video on Katie. Have good gait, good posture, all of that is good. I will say that one thing I forgot was to do when we were doing her hands was to do her coordination, her rapid coordination by doing this. And if you'll just if you will do this and then touch your finger to your pointer finger to your nose, now touch it to my finger. Every time I move it, do it again. Okay, that was just to test her coordination and fine motor movements, and that concludes our video. Thank you.